video, I'm discussing about tracheostomy. So tracheostomy comes on exam, respiratory system examinations. It can become as a patient with tracheostomy, and another it comes as a video station. So as usual, we do the respiratory system how we do, and what we find in general observation, there is an equipment that is tracheostomy on child neck. The status child may be in distress, and dysmorphic features some we can be find. Tracheostomy associated with Piari-Robin syndrome, Trichar-Collins syndrome, and Goldenhar syndrome. Remember this syndrome, and also achondroplasia and Jones syndrome can be. So mainly the dysmorphic features are Piari-Robin syndrome, Trichar-Collins syndrome, and the Goldenhar syndrome. The child growth is small for her age. There is chest deformity can be present, and I would like to complete my examination by 3S, that is sputum port, spirometry, oxygen saturation checking, and the 3P plot on the centiles, BCG scar, puberty plus ENT. I'm again repeating. I would like to complete my examination 3S, sputum port, then spirometry and oxygen saturations, then 3P plot on the centiles, BCG scar, and the puberty plus ENT. That is examinations. So they ask what are the questions in video stations or clinical, what are the indications of tracheostomy. So indications of tracheostomy are that subglottic stenosis, trauma like road traffic accident, neuromuscular weakness like GBS. Number 4, prolonged intubation. Number 5, severe gastroesophageal reflux disease. Number 6, severe sleep apnea. Number 7, irradiation. Number 8, upper airway obstruction. And number 9, congenital airway problem. And indication of tracheostomy, acute case. These are angioneuritic edema, anaphylaxis, example. Number 1 and number 2 is severe infection like probe, epiglottis, and diphtheria. I'm again repeating the indications of tracheostomy. First of all, it can be like subglottic stenosis, number 1. Number 2, trauma, like road traffic accident. Then neuromuscular any disease, Guillain-Barré syndrome. Number 4, it can be prolonged intubation. 5, severe gastroesophageal reflux disease. Number 6, severe sleep apnea. Number 7, irradiation. Number 8, upper airway obstructions. Number 9, congenital airway problems. Indication for tracheostomy, acute, these are angioneuritic edema, that is anaphylaxis, example. Number 2, severe infection like probe, epiglottis, and diphtheria. What are the complications of tracheostomy? They also ask. That is obstruction by the secretion may cause hypoxia, number 1. Number 2, dislodge. Number 3, ulceration. 4 is infection. 5, bleeding. 6, aspirations. Number 7, arrhythmia during suctioning. Number 8, air embolism. Number 9, structural damage to trachea. Number 10 is pneumothorax or emphysema. I'm again repeating the complications of tracheostomy. Number 1 is obstruction by secretions may cause hypoxia. Number 2, it can be dislodged. 3, infection. 4, bleeding. 5, ulcerations. 6, aspirations. 7, arrhythmia during suctioning. 8 is air embolism. 9, structural damage to trachea. 10 is pneumothorax and emphysema. How can we manage the complications? Number 1, if it is blocked the tracheostomy, we give the suction with saline. If it is dislodged, then reposition and fixations. Number 3, bleeding, then suction to the prevent clot, compression, give tranexamic acid. If no obvious cause, put cuff tube to prevent the aspiration of the blood. Again, repeating the management of tracheostomy complication. First, if it is block the tracheostomy, then we suction with the saline. If dislodgement occurred, then we fix, reposition and fixation. If bleeding, then suction the clot, suction to prevent the clot. And compression, give tranexamic acid. If no obvious cause, put cuff tube to prevent the aspiration of the blood. Another what advice I will give the parents for tracheostomy child, that is observe for displacement, number 1. Number 2, observe during feed. Number 3, suction before feed. 4 is regular follow-up. So 4 advice I am giving. Number 1, observe the dislodgement, observe before feeding, suction before feeding, and regular follow-up. What you mean by the decannulation? What is decannulations? We mean that to remove the tracheostomy tube when primary condition is resolved and need bronchoscopy to assist the airway. So decannulation means that to remove the tracheostomy tube when primary condition is resolved and need bronchoscopy to assist the airway. What are the types of tracheostomies? That is cuff, uncuff, and fenestrated. Again repeating, cuff, uncuff, and fenestrated. What are the syndrome associated with tracheostomy? Trichar-Collins syndrome, Goldenhar syndrome, Piari-Robin syndrome, achondroplasia, and Jones syndrome. This is all about tracheostomy. It comes on video station and respiratory system examinations. Thank you very much.